Norma verticalis. Norma verticalis, also called as skull cap or vault, consists of three bones mainly: frontal bone, two parietal bones, and an occipital bone. And it consists of the following three main sutures. This is the coronal suture. This is the sagittal suture. Coronal suture separates the frontal bone from the parietal bone. Sagittal suture separates two parietal bones of either side. And then we have the lambdoid suture or lambda suture that separates the occipital bone from the parietal bone. Sometimes an additional suture is also present on the frontal bone. Okay? That is called as metopic suture that fuses approximately around 6 years of age and separates the frontal bone into two halves. Certain other features in the parietal bones include two parietal foramens that are present on either side of the sagittal suture, a parietal tuber, which is a elevation present on the parietal bone. Okay, that is the site of first fracture on the skull. Okay, and a point called as oblion is also present. The vertex is a point which is the highest point of the sagittal suture. So that was it for the norma verticalis. And yes, the point where the coronal suture and the sagittal suture fuses, okay, in the babies there is a fontanelle present that is called as interior fontanelle. Fontanelles are the membranous gaps that allows the growth of the brain to occur. Okay, these fontanelles fuses at certain years of age. For example, the anterior fontanelle in between the frontal and the parietal suture, at the junction of frontal and parietal suture, fuses approximately at about 18 months of age. Okay. Now at the junction of the sagittal suture and the occipital suture, okay, over this point, okay, here posterior fontanelle is present that fuses approximately at 2 to 3 months of age. Okay, so this was all about the norma verticalis.